Piles is basically a disease when the patient comes to us that he is something coming out of his anal opening after passing stool, or he gets a severe pain after passing stool, or there is bleeding which is not stopping after passing stool, or especially after straining for the stool. So these are the three common symptoms. Some of the persons come that there is some discharge coming just around the anus, and they tell they have piles. But exactly these is not piles, they are having fistula problems which through which they are getting this discharge. The treatment of these three things varies. If it's a piles, like which we call as hemorrhoids, there is bleeding, there is something coming out through the anus, and there is a specific history of constipation, or if the disease is in the family, or the patient has like a prolonged sitting problems, they can develop these things. So for the piles, the treatment we are offering is either if the piles is grade 1, very small piles, we just try to give them medicine and try to treat it. If it is increases to grade 2 or grade 3, then there are different procedures available. One is in the form of digital ligation of hemorrhoidal artery. The hemorrhoids which has occurred, we just from the artery, from the root cause, we ligate this, we stop the blood supply, and this piles gets cured. If the piles have become very much out, if it's coming protruding, and patient is getting a lot of symptoms like they have to manually reposition whatever is coming out, and the bleeding part is high. So after evaluation, many of them we offer a minimal invasive procedure which is known as stapler hemorrhoidectomy. This is another procedure which we offer for the prolapsed piles, and patient get very good results with this, and piles get cured. The major problem with piles patient is they tend to shy away with the problems. They don't know whom to talk. They always keep on bleeding, but they feel shy that they think that they have done some mistake because of which this has happened. I tell them that you don't make yourself responsible. Constipation or whatever the issues are there, it may be the cause of this thing, and you are not responsible for it. And if even if the causes are there, then if we educate them regarding what are the causes, they get the treatment done. And if the treatment is surgical, we do the surgery. Many a times, most of the patients we try to treat just by medicine, but if it has crossed a limit, then maybe this patient requires surgery, and surgery is a very good answer. They get 100% cure out of this. Another another problem, as I told you, we are doing a lot of fistula surgeries. Fistula, I told you, some discharges coming just around the anal canal. Patient are either it's a form of blood is coming or pus is coming, or sometimes patient are passing gas from the side of their anus. They feel that because this is fistula is a communication between the just opening around anal canal, and it is connected inside with the rectum. So either pus is coming, sometimes the stool is also coming through this fistula opening. We have devised a special technique at here where we are using a special instrument. We call it WAFT, video assisted fistula treatment. We do which is a minimal invasive technique. Patients get a very good results. There is not a lot of cutting in that area, so the recovery is fast. Otherwise, for a fistula problem, in routine surgery, the healing takes place almost 6 to 8 weeks, because there is a big wound and it takes time to heal. But the procedure which we are doing here, we are using a WAFT video assisted technique, and we scrape out the fistula. We do the minimal incision in that, which heals very quickly. We evaluate, like if the patient is having a severe bleeding, their hemoglobin levels are falling down. I have seen many patients because they are just shying of the problem. They are not telling, they are not going to the doctors, and their hemoglobin keep on falling. Their hemoglobin, which was supposed to be more than 12, can become up to 4, and which that hemoglobin is dangerous for their life. They can become congestive, they can get heart failure because of this. patient has come to us, they come with the problem of heart failure, and when we analyze them, we get to know from their history that they had piles. Piles can be can be life threatening. I have seen patients who have come to me with a problem when they have their hemoglobin is reduced to an amount that it becomes 4 to 5, and they develop the heart failure thing, and they primarily come to us with a heart failure, and when we analyze them we get to know that he had piles and he was continuously bleeding out of that. So another problem which can be these piles, which hemorrhoids can become infected, then they can cause gangrene to these persons.